I think some people have a magic. They can feel the
Hmm.
pain. When you touch the muscle, you know exactly which
Which
muscle
muscle?
is
Yeah.
stiff.
We study that for 4.5 years. We
Yes.
dissect dead bodies to
Yeah.
understand,
Yeah.
okay, what are the muscles, what are the nerves. So that
Yeah.
itself, like, if the person can understand, diagnose it well, then
Yeah.
treatment is
Yeah.
not a problem at
So
all.
you
Mrs. Bajoria travels a lot, as we all know, and gymming is also her favorite part of her day-to-day activity. So maybe little with gymming and all, little strain sometimes happens when we are lifting weights. So we are trying to mobilize the neck and release her pain or spasm, whichever she's feeling, the stiffness which is there. So this stretch always helps. The upper trapezius muscle, which generally gets strained in doing these activities, and we also mobilize it with our hand wherever we feel the stiffness. Mobilization always helps in these kind of muscular spasms, muscle stiffness, and helps in reducing the pain instantly. So we'll see the range sideways. Yeah, that's much better. Yeah. Okay. So that's good. Looking up, let's see. Yeah. Okay. Looking down. Yeah. Much better. Much better.
Yeah, much
That's
better.
very good.
Much
And this is also better, I believe.
Yeah.
This is also much more free in comparison to the initial phase.
Not flexible, less rigid.
Ah, much better. That's good.
Yeah.
That's good. Hi, this is Dr. Tahmina, your physio fitness and rehab expert. And today we are glad that we have Mrs. Smita Bajoria with us, who definitely doesn't need an introduction to any of us, but still to honor her, she is the Consul General of Denmark, as we all know. And at the same time, she is the director of the TPA company Heritage. And she is a businesswoman, an entrepreneur. So definitely doesn't need an introduction to us. But Mrs. Bajoria, you tell me, along with that, you have a very hectic schedule. You travel a lot. You love traveling. You love gardening. And you love to do your gym. You remain active throughout. So I've seen that. I have been treating you for your neck pain. Last time we met, it was your knee. So all these problems, are you getting benefit with physiotherapy? Is it helping you in your day-to-day life? How is it helping, if you can tell to us?
Yeah, Tahmina, it is. I think I regard you as one of the best physiotherapists, and we've had a relationship. So my problems are that you're sort of traveling long time in a plane, neck is getting stiff because the pillow is not proper, or I'm doing gym and you have sports injuries, doing wonders on my knee and on my neck.
Thank you. I think for the neck, I had to use a dry needling technique. I used a needle for you, na? So that also helped you.
Yes, and I think that what I recommend is that we all tend to pop pills, painkillers. And
For you also and others also, we generally use laser, we use IFT or TENS and all. So which are very safe, which can be used for long-term chronic cases also. And instantly, so in 2-3 days, you have seen it gives like instant relief. Like when we use these modalities, and which are much better than popping in pills, which in the long run definitely will affect our kidney and liver. We get used to.
And I've seen it in the case of my mother-in-law, because she was also very old.
Yeah.
And my uncle, who was almost 95.
Yeah, of course, of course.
Physiotherapy, you've been there, you've done it. When they have issues like they need lung physiotherapy or chest physiotherapy, they have stiff muscles. So I think that it's a great remedy and a great treatment for even older people who are not so mobile. So you need blood circulation, you need like soft tissue mobilization and stuff like that. So I think that this is something which is a benefit. And also, the physiotherapist, I think some people have a magic. They can feel the pain. When you touch the muscle, you know exactly which muscle is stiff.
We study that for 4.5 years. We dissect dead bodies to understand, okay, what are the muscles, what are the nerves. So that itself, like, if the person can understand, diagnose it well, then treatment is not a problem at all.
You obviously know the job. I know for a fact that you know your job, and I think that we're very lucky to have you and your colleagues.
Yeah, true. To treat and help patients in pain. That's true. And not only pain, as you mentioned, if it's elderly people, geriatric, we are treating pediatric children also who are having certain like developmental milestones, delayed developmental milestones. So those kind of cerebral palsy children, we are treating geriatrics with stroke, with Parkinson's, those kind of problems, independent as much as possible. Even after 90 also, we see patients, as you said, your uncle also above 90. So we have treated him. He was having, at one point of time, he was having severe neck pain. That also he got benefited in just 5 days. We cured him.
When he had a fracture in his
Fracture
arm,
in his
Dr.
arm,
Hassan
yeah.
did the surgery and post-surgical
Rehabilitation for the arm, and then it became absolutely fine. He was
Yeah.
able to move it
Yeah,
full range,
full
like
range.
post-surgery.
Yeah.
We do the proper rehab because
Yeah.
any surgery without proper rehab is a failure, I believe. So that's a good aspect that you reminded me. We
Yeah.
also did that.
Yeah.
So definitely that if we try physiotherapy, that might also gain our range, our momentum, our sports if we get injured. So 2-3 days if we take physio, we are back to field. So all these all together, like physio has various aspects. Vestibular, sometimes we get vertigo, headache,
Yes.
dizziness. So that itself, like we do Apley's maneuver in those kind of conditions. Vestibular rehab, so it's very important. Post-operative conditions. Pain, of course, that goes without saying. We treat pain quite often. So along with that, these are the different folds of physiotherapy that we have, and we can always provide patients, help them out if they are having these kind of problems. So thank you, Mrs. Bajoria. Thank you for devoting your precious time to us and having this interview with us. And your neck is also much better, I feel,
for me
right
it's
now.
a pleasure. I think thank you for me to say to you would be very flippant in a way, because I think you've done so much for me and all my family members that we are really grateful. That is something which is very appreciated, at least within my family and whichever friends I've introduced you to.
Yeah, of course. Thank you so much. Thank you, Mrs.
Thank you.
Bajoria.
Thank you.
Thank you.
Thank you.